My name is Patricia Eldridge, and I am HIV positive. I've been HIV positive for the past 14 years, and if it wasn't for early detection and the ability to go and get some of the treatment, then my son, who is 13, would also be positive, but thankfully he's negative. Initially, my story begins with what I thought was to be a routine test and turned out to be a completely different experience than what I expected. The clinic where I went to get my routine test and find out my HIV status, after they told me that I was positive, told me that it would be 2 months until they could see me again. So they sent me out basically bewildered, and my whole life changed in an instant. I had a very difficult time making it through the 2 months, and I finally found another clinic where they were able to give me an update exactly what does it mean now that I'm HIV positive. Unfortunately, around that same time, I also found out that I was pregnant. In the clinic that I was going to primarily dealt with gay men. They did have a lesbian clientele as well. However, as a pregnant female, I was a bit of an anomaly. They sent me to another doctor their female patients would normally go to for their gynecological needs. At that point in time, that doctor was unable to treat me because of my HIV status. So after that, they sent me to another hospital where they had a program for HIV positive women. And when I went there, what the nurse did on intake was told me that as a positive woman, how could I do that to my child, and why didn't I just have an abortion? I believe in a woman's right to choose, but for me at that point in time, it wasn't the choice that I wanted to make. So luckily, the doctor that I saw was able to point me in the direction of another hospital where I did finally get the treatment that I needed. Unfortunately, there are so many women out there that don't have the perseverance nor the strength at that point to continue, or the education in some instances, to continue to find the health care that they need. Also, I know that I sit in a position of privilege because not only did I have the perseverance, but I also had a job, I also had insurance, and I was able to access doctors and health care. However, those things sometimes have also been limited. My insurance does not cover all of my prescriptions, and depending on the type of coverage that I've had, I have to pay several $100s for my medication per month. If I had to pay that out of pocket, that same prescription that I need to take on a daily basis will cost me over $2,000. And of course, I'm not a homeowner at this time. So I just want to say that it's very important to me, not just for my own self and not just for my son, who as a result of the medications and the care that I did receive is negative and therefore does not cost the United States any additional money. What I think is that we can do something that we all need and get the health care that's required. As the economy has been in the state that it is, we have had the haves and the have-nots. Over the last year or two, we've created a new category of the used to haves. But when it comes to health care, there's only one category, and that's need. Thank you.